Well, I think there's undoubtedly a mental health crisis in the United States, as there is in every developed country around the world currently. And sadly, we're seeing the need for mental health increase at a much faster pace than the resources available to provide people with the help they need. In fact, the number of suicides in America has reached a record number. There are over 38,000 suicides in America right now per year. That's twice as many homicides. And we are in a situation in many states like South Carolina where there are many, many rural communities that have no mental health services of any kind in their area, in their county or in their town. So that complicates things for the person living in a community like that, because they would have to travel significant distances. And so the opportunity arose to provide the virtual teleconsult service to patients and physicians caring for those patients in need of mental health services.
It's the future of medicine. It is where medicine is going, and I'm also aware that as far as marketing, it's a service line that I can offer my patients. It makes it easier for my patients. They can see a lot more specialists. They don't have to take the whole day up at Charleston. Now they can come in for an hour. And like I said, as far as service lines, it's good for marketing to say, hey, you don't have to travel. You can come to our office. We'll get you where you need to go. The way it works is I'll go in, the patient comes in, they talk to him on the screen, then he actually calls me and he and I talk one-on-one. Then I go in the room and talk to the patient and review what they've talked about. So basically not only are they talking to about the case with their specialist, and then I come in behind them and I review it so they make sure they understand it. So I think that's actually great. And I think that's what parents like the most about is that they're talking to the specialist, and then the doctor they're used to comes in right after the fact and says, hey, how'd you like it? This is what the plan is, so they really understand the plan a lot better. I think the biggest thing is the social media. Before social media, kids could have an issue at school, they would go home, it'd be done for the day, and then tomorrow they have to face up with it. Nowadays, they have an issue at school, there's social media, it follows them from school to home so they can't escape it. And so you're seeing a lot more depression and anxiety because they're not able to escape that environment as easily. Now on the flip side, I think we're also screening for it a lot more, so we're recognizing it. Years ago, we just said, oh, it's the usual teenager, they're going through hormones, they're depressed, everything's going to be okay. Now we see, it's actually a bit more serious, so we actually need to look for it and actually treat it. We had a young man, actually just the other day, who mom came in and she was just telling me that he has done extraordinarily well ever since Dr. Gwynette was able to get involved and make some modifications to his medication. I mean, we worked with him for years and we kind of get some success and he'd kind of go backwards, but ever since Dr. Gwynette has been involved, he's actually done stellar. So yeah, we've had some very good responses. For me, I don't have any pride. I mean, for me, it doesn't matter who solves the problem as long as the patients get taken care of. And so for me, if it means that I have to defer out to another doc, work with another doc, I'm fine with that. So at the end of the day, as long as my patients are healthy and happy, I'm fine.
Access to health care improves the quality of your life, then I can't help but believe that by improving access and providing more people the opportunity to get the benefits of tertiary care, of mental health services, of these relatively scarce resources, it must be better. Otherwise, why do we even bother? So we know we have a lot of people who cannot access these resources. We know that there's a tremendous need especially in our rural communities, for access to high quality health care. Well, I can only imagine us looking back in 10 years and asking, why didn't we think of this sooner?